A man in North Carolina, follow me on this, is naturally brewing beer inside his body. Never amazes me what the human body can do. Dr. Richard Chaffoo is here to explain more. Explain anything. Doctor, good morning.
Good morning, Raoul.
So apparently I have no idea what this is. I've never heard of it, but it was discovered because the guy got pulled over by the police. Explain what happened here.
Yes, exactly. So, Raoul, this man was pulled over, thought to, had a very high blood alcohol level, refused a breathalyzer test, and went to the hospital, had a blood alcohol test that was quite high, and they didn't believe him. They thought, well, sure, of course you've been drinking alcohol, because he had all the symptoms of alcohol intoxication, which in fact he had, but it was due to the fact that he had been taking antibiotics for several weeks for an infection. And unfortunately, Ro, what happened was he altered the natural microbacteria that exist within our GI tract.
Wow.
So he actually overgrew a couple of yeasts that are responsible for making beer, making wine, and fermented alcohol. And so when he was taking in carbohydrates, they were converted into alcohol, and his blood alcohol level was like 2.5 to 3 times the normal level.
I think it was a 0.2.
0.2.
And he knew he hadn't
adamantly refused that he'd taken
anything.
Exactly. Initially, they actually didn't believe the man. He ultimately had a fall, had an intracranial bleed, was transferred to a larger hospital, neurosurgical procedure, and then they did some more studies. All the lab tests came back negative, except for a stool sample that demonstrated this fungus was present.
And credit to the doctors for continuing to find out, because the guy was legit enough where they thought, something's going on here. I wanted to ask how someone can develop this, but because a lot of people take antibiotics and not everybody develops this rare condition.
Exactly. So in fact, Raoul, you're right. It is extremely rare. However, what's not so rare is the fact that we take antibiotics too much in our society, and we've seen a lot of these superbugs, these organisms that become very difficult to treat. And also, there's a more common condition that can happen with people taking long-term antibiotics, something called pseudomembranous enterocolitis, which is actually can be a life-threatening infection of the lower GI tract, again related to taking antibiotics for a prolonged period of time and altering that delicate flora that exists within our GI tract.
Now, when we say things like, oh, he's brewing beer, he's brewing alcohol, is that legitimately something? I mean, can people actually do this on purpose? I mean, not to ask like a...
No, so it's extremely rare. I mean, literally, there are literally a handful
all the elements
of
have to literally come into just play at the perfect time.
Yes, and you got to be able to make, you have to be able to grow a certain fungus that will ferment this.
And this guy just happened to be that person.
Yes.
Treatments?
So
what happens next for this guy?
So exactly. So first of all, you have to, number one, identify it, identify what the organism and treat it. So initially he was treated with restriction of carbohydrate diet, but he had a recurrence of this, and ultimately through some research they decided, well, let's go ahead and treat him with antifungal agents, some of which are quite powerful medications, and that did clear the problem up for him.
I mean, the implications of that and alcoholism, are there any kind of similarities there if he kept...
So,
if he didn't maybe never realize it.
You're right, and so certainly, I mean, alcohol toxicity could have effects on his brain and his other systems. So certainly, the alcohol is the same as the alcohol that we would consume. It was in very large amounts. So it's a rare syndrome. There was another woman in Upper New York State that actually beat a DUI conviction once she was able to determine she had this. So it was a rare syndrome, not very common, but certainly can have life-threatening implications.
Did it show itself? I mean, was he acting drunk?
He was acting drunk. Not only was he smelled of alcohol, he had slurred speech, he had a lot of gait problems, and there were actually changes in his mentation. He began to become depressed, aggressive behavior, this brain fog that people get from chronic alcohol use. So he had that appearance of someone that was an alcoholic, but it was, instead of being exogenous from something we were taking in, it truly was something endogenous from inside.
From within. Unbelievable. Do you know in this case study if this guy had it happen before? Was this the first time this has happened? Maybe it's been happening for a while and he just didn't realize.
It could have been happening before, maybe on a smaller scale. And they're now doing some studies looking at some treatments for people that have this rare condition, maybe probiotics or maybe something called fecal transplants that actually can help in these situations, but they are extremely unusual. But they do highlight the fact that antibiotics are not benign, and so we have to be careful about the use of antibiotics when we're treating bacterial infections and how long that course of therapy should be.
It's like you said, we pop those antibiotics like they're nothing. They're still doing
They're not aspirin.
Things.
Exactly.
They're not aspirin. Dr. Richard Chaffoo, bizarre, but fascinating. Thank you, Doctor.
Appreciate it.